All right. So we'll jump right in. As I mentioned, we are about to enter Memorial Day weekend, the unofficial start of summer. We've seen the forecast. It's going to be nice and sunny, warm. A lot of folks will be spending a lot more time outside. Kids are heading into summer vacation too. When we think about this time of year, the fact that we see a lot of folks outside, but the importance of having that protection, not just for those of us with fair skin, but maybe folks with darker skin tones who think that they're already protected from the sun. What is your advice when it comes to that?
I think that's a really great point that you raised, because actually statistics have shown that daily use of an SPF of 15 sunscreen can actually decrease your risk of squamous cell carcinoma, which is a type of skin cancer, by almost 40%. So if we are starting with good habits, using daily moisturizer with a little sunscreen in it, it actually can protect ourselves from the sun and the harmful rays of the ultraviolet light. So keep in mind that sun exposure and cumulative sun exposure can increase your risk over time. And so there are some patients, like you mentioned, that have skin with melanin and color to them. And it's a bit of a myth to assume that because you have darker skin or you tan very easily, that you're not at risk of skin cancer, but you are, because one of the biggest risk factors for skin cancer is actually ultraviolet exposure.
And so something you mentioned is that daily use. So it's not just something that we're thinking about when we are going to be outside, when it's really sunny out, we don't have any clouds in the sky. I mean, this is something that we should be thinking about no matter what the weather looks like.
That's exactly right. It's just part of your daily routine. So if you incorporate it, it becomes habits. So just like when you get in your car, you wear your seatbelt. When you start the day, you actually, do your normal routine, and just a little bit of that sunscreen and sun protection will actually help you along the way. So it just becomes a good habit because it's cumulative sun exposure. So if we are starting off with the good habits early on, then we'll keep ourselves out of trouble.
And you mentioned those good habits early on. When we think about skin cancer, for some reason, it seems like a lot of folks associate that with adults or folks who may be a little bit older, but that's something that we need to be thinking about for our kids too, right?
That's right, because it's actually, in terms of sun exposure, it's accumulative. So it starts off when you're a kid and teenager, and it accumulates over time. But more importantly, when it comes to the sunburns that sometimes happen, it's the early childhood sunburns, particularly the blistering sunburns, which are the biggest risk factor for some of our skin cancers. In addition, the number of sunburns over your lifetime, whether it's when you're a kid, when you're a teenager, and to adulthood, it all accumulates. So if we're able to try to avoid those sunburns as much as possible, we'll be able to stay out of trouble.
And what are some of the things that we're looking for, particularly with dark skin? I mean, is a sunburn going to look or feel like what we might see in someone with fair skin?
So actually, when it comes to skin of color, we have a little bit more melanin in our skin. So we have a darker skin pigment, whether we're Asian, African American, Hispanic. And so it's a little bit of a myth to assume, well, we don't tend to sunburn, but we can still tan. And again, that's basically sun damage that accumulates with sun exposure. And so we want to make sure that we're not assuming that because we don't sunburn, that we won't have some of the effects of ultraviolet light on our skin.
Mm-hmm. And so what are some of the things we want to be looking for when it comes to protection? What are some of the best ways to make sure that we are protected from the sun?
So I think one of the first things you want to do is try to avoid the sun if you can. So if you are outside, you want to try to stay in the shade. You want to use your sunscreens if you can. And what you're looking for when it comes to ingredients for sunscreens, you want to look for broad spectrum. So it's going to be covering ultraviolet A, ultraviolet B, sun rays. You also want to make sure it's water resistant, because when it's going to get hot after Memorial Day, we're going to be sweating, perspiring. We're going to be working out in your yards. We're going to be swimming. So we want to make sure that's water resistant. We want to make sure that we're using it appropriately, meaning using enough. Sometimes we're a little too stingy when we apply it. You want to apply it liberally all over the skin that tends to be exposed. And we also want to make sure we reapply every 2 to 3 hours. But it doesn't just have to be sunscreens to help with sun protection. So we recommend hats, good quality sunglasses. You can wear protective clothing, long sleeves, gloves, things along those lines that can be really protective. There's some great rash guard swimsuits. So again, these are little things that you can do that if you are consistent with them, you can stay out of trouble when it comes to sun damage.
And I do finally just want to talk about the fact for anyone of any color at any age, what are some signs that, or maybe what are some things we need to be doing to make sure that we're not experiencing any type of skin cancer, or maybe any kind of signs that we are headed in that direction?
Right. So some things to look for is we want to be consistent with protecting ourselves from the sun. So that's one thing. We also want to make sure that we don't ignore some of the signs that our skin is giving us. So if we say, gosh, I have this area that seems to be very sore or itchy, or I think it's a dry patch that just doesn't seem to want to heal. I'm putting moisturizers on there. It's never resolving. Particularly in skin of color, sometimes skin cancers will present a little differently than in lighter skin or in Caucasian skin. So for example, if you have a pigmented patch that just seems to be itchy, spreading, not improving, we put moisturizers and it stays persistent. These are some of the signs that we're looking for. So we want to make sure that even though we don't necessarily have sunburns per se, we can still have some damage to our skin from sun exposure. And if there's ever any concern, we want to make sure that we go see a dermatologist or your physician to ask, is this something that I need to be worried about? Because anybody can develop skin cancer. And in particular, we want to make sure that we diagnose early and that we treat appropriately and keep people safe.
All right, perfect. Is there anything else you think that we missed that you wanted to add?
I don't think so. I think just like you're saying, it can be a myth to assume that because we don't tend to, skin of color doesn't burn, that you're not necessarily getting sun exposure, and that's not true. You also want to make sure that there is also a myth that skin of color doesn't develop skin cancer. That's not true at all. In fact, that is a little more rare, but can often be diagnosed later and actually more aggressive, and sometimes a little bit more difficult to treat. So we also want to make sure we're emphasizing that people are getting things checked out if they need to.
All right, perfect. I think we covered it all. Thank you so much.
Great. Thanks. Well, it's nice to meet you.